Good morning and good evening, Your Excellencies, esteemed guests, friends, and colleagues, and welcome to the annual State Forum of the International Vaccine Institute. My name is Youngmi Jo.
And my name is Colin McCann. Before we begin, we would like to ask our guests on Zoom to kindly mute your microphones until you are invited to speak. For our Zoom participants, we have reserved 10 minutes for a question and answer session at the end of the forum. If you would like to ask a question or share a comment, please type it in, direct it to the Q&A account on Zoom at any time during the presentations. During the Q&A, we will go through the questions in the order which we receive them. For those observing the State Forum via YouTube, we will review your questions as time permits.
We will now start the State Forum with welcome remarks from Mr. George Bickerstaff, Chair of IVI Board of Trustees, who joins us live from the United States.
Good morning, good afternoon, and good evening. I welcome everybody to the second annual State Forum, which commemorates our founding as an international organization. I'd particularly like to thank and welcome Madam First Lady of the Republic of Korea, Kim Jong-suk, Her Majesty Queen Sylvia of Sweden, Your Excellencies from the Republic of Korea, Sweden, India, Finland, Mexico, Pakistan, and ambassadors joining us live from Zoom. And I'd also like to thank very much our partners in global health, which include the World Health Organization, Gavi, CEPI, UNICEF, and Professor Peter Holtz. Let me give you a little history about the International Vaccine Institute as context. We were founded 23 years ago by the United Nations. At that point, we had 35 signatory countries. At this point, we currently have 36 signatory countries. We have 4 funding members. Our mission is to save lives from infectious disease. Our mission has never been more important than it is now, given COVID-19. We're helping to solve this global crisis through cooperation and vaccine diplomacy. Our development of the oral cholera vaccine was a product of multilateral cooperation and public-private partnerships made possible by many of the partners joining us today. Vaccine diplomacy will continue to play a key role in ensuring countries and the international community work together to solve global health challenges. We, IVI, remain committed to working together to prevent and eliminate the spread of infectious diseases, especially in resource-limited countries. Again, I welcome everybody to our second annual and first virtual State Forum. I encourage everyone to have open discussions. We look forward to having many more of these in the futures and perhaps to even add some additional state sponsors in the future. Thank you very much.
Thank you, Mr. Bickerstaff. And now we are honored to present you with a pre-recorded congratulatory message from Madam Kim Jong-suk, the First Lady of the Republic of Korea and Honorary President of the IVI Support Committee.
안녕하세요. 조지 비커스텝 국제백신연구소 이사회 의장님, 제롬 김 국제백신연구소 소장님, 보건백신 관련 국제기구 관련자분들, IVI를 후원해 주시는 회원국과 내외 기빈 여러분 반갑습니다. 오늘 국제백신연구소 연례협력국 포럼에 스웨덴 실비아 왕비님과 함께 하게 돼 더욱 뜻깊습니다. 전 세계가 코로나19와 싸우고 있는 팬데믹 상황에서 백신과 치료제 개발 및 균등한 분배라는 IVI의 목표는 이제 국제사회의 최우선 목표가 되었습니다. 대한민국 국민들이 이웃에 대한 배려와 양보를 통해 모두의 안전과 자유를 지켜나가고 있듯이 국제사회의 상생 번영을 위해서는 지구촌 공동체가 한마음으로 연대해야 합니다. 문재인 대통령은 지난달 유엔 총회 기조연설에서 각자 도생이 아닌 모두를 위한 자유의 정신을 제시하며 포용성을 강화한 국제협력 실천을 강조했습니다. IVI는 지난 23년간 포용성을 강화한 국제협력을 꾸준히 실천해온 국제기구입니다. 빈곤국가, 개도국을 위한 저렴한 백신 개발과 공평한 보급을 통해 국제사회에서 소외된 지역의 소중한 생명을 구하며 전 세계 모든 사람이 전염병으로부터 안전한 세상을 실천하기 위해 매진해 왔습니다. 대한민국 정부 또한 현재 코로나19 위기로 고통받고 있는 빈곤국가, 개발도상국까지도 백신과 치료제 개발의 혜택을 받을 수 있도록 세계보건기구와 세계백신면역연합의 세계 백신 공급 메커니즘에 대해 적극 참여하고 있습니다. 감염병 질병으로 인한 개발도상국의 고통을 해소하기 위한 IVI의 백신 개발과 보급 노력에도 협력해 나갈 것입니다. 더 많은 국가와 더 많은 협력 파트너들이 IVI가 꿈꾸는 미래를 앞당기기 위한 노력에 동참해 주시기를 바랍니다. 특히 IVI가 준비 중인 백신 외교 우호 그룹에 더 깊은 관심을 가져주실 것을 부탁드립니다. 저 또한 IVI 한국 후원회 명예회장으로서 IVI의 비전을 실현하기 위한 연대와 협력 강화를 위한 최선을 다하겠습니다. 감사합니다.
Thank you, Madam First Lady. Now, we are equally honored to present you with a pre-recorded congratulatory message from Her Majesty Queen Silvia of Sweden.
Dear First Lady, dear distinguished guests, dear ladies and gentlemen, it is an honor to address the International Vaccine Institute on this State Forum and at the occasion of the launch of the Vaccine Diplomacy and Advocacy Group. It is also a pleasure to see the First Lady among speakers today. We met last year at the occasion of the state visit to Sweden. Sweden has enjoyed a long-standing relationship with this institute. It was very interesting to visit IVI in Seoul during the Swedish state visit in 2012. What is impressive to see is the tireless work by the IVI at the service of women, girls, men and boys struck by curable diseases in less favored countries and environments. This dedication to developing vaccines against diseases that mainly affect the most vulnerable makes my country proud to call itself a true friend of IVI. Sweden has supported the Institute from its inception. This is out of a conviction that IVI can contribute to the shared vision of a world free of infectious diseases. The current global pandemic threatens to overwhelm health systems around the world, particularly those in resource-limited settings. It is crucial to support research and solutions that enable all countries to respond to global health hazards like COVID-19 in an equitable way. But let us not forget the persistent threat from other endemic and neglected diseases which cause so much suffering, and where the IVI is leading the way. Dr. Jerome Kim and his excellent staff deserve our deepest gratitude. Thank you.
Thank you, Your Majesty. The Director General of IVI, Dr. Jerome Kim, will now speak on IVI's vaccine development in the context of South-South and triangular cooperation. Jerome.
I'm so used to having the mask on. Good day, Excellencies, distinguished guests, ladies and gentlemen. IVI is an international organization that was born in 1997 founded by the United Nations Development Program. Our headquarters is here, near Seoul National University, and we were the first international organization to be headquartered in Korea. With our 36 signatories and state parties, we are committed to the mission of IVI, which is to discover, develop, and deliver safe, effective, and affordable vaccines for global health. We work all over the world, historically in 75 countries, currently in 24 countries. You can see the world map colored by program. We've recently added efforts in Colombia, Panama, and Thailand as a part of the chikungunya vaccine development effort funded by CEPI with the Indian vaccine manufacturer Bharat. We're often asked, how does IVI differ from other global health organizations? If you look at the top of the slide, you see that we start with the generation of surveillance and evidence of burden. We can take things in the laboratory where we develop vaccines. We can test those vaccines in human populations all the way through licensure and registration. And then we get involved in the delivery of vaccines, primarily to understand the effectiveness of the vaccines, how the vaccines work in the real world. This distinguishes us from many of the global health funders. Gavi, which purchases vaccines for distribution in low and middle income countries, UNITAID and the Global Fund, which are really focused on HIV, TB, and malaria, and CEPI, which is actually focused on only vaccines for emerging infectious diseases. We actually partner with CEPI in chikungunya and also in COVID-19 clinical trials here in Korea. Now on to South-South triangular cooperation. It's actually composed of two different kinds of cooperation. First, South-South cooperation, which is a framework for collaboration between low and middle income countries to share knowledge, skills, expertise, potentially resources, to meet specific development goals. And then also triangular cooperation, which facilitates this South-South cooperation by triangulating or identifying sources for critical technology, funding, training, or other kinds of support needed to advance these development goals. The three components of SSTC include the pivotal partners who, for vaccine development, provide vaccine technology, training or capacity building, leadership or mentorship in clinical trials, and support for licensure or WHO pre-qualification, which is critical for vaccines to get out and be used for global health. Facilitating partners provide funding, could provide clinical trial support, provide very important partnership linkages and advocacy for the efforts that advance development goals. Finally, beneficiary partners receive the vaccine manufacturing technology or vaccine technology, receive training, and improve their capacity to do vaccine development research, and eventually have vaccines licensed for use within their own borders. IVI seeks to be the engine for SSTC, collaborating with the pivotal partners and being a pivotal partner ourselves, working with the facilitating partners to obtain funding or clinical trial support, and working importantly with the beneficiary partners, because part of IVI's mission is to develop capacity around the world to implement vaccines that are critical to global health. Let's take some examples of what IVI has done in the past. Two examples from cholera. The oral cholera vaccine, or OCV, was actually initially transferred from the University of Gothenburg in Sweden to a small Vietnamese biotech company, VA Biotech. That formulation did not meet WHO standards, so IVI, working with Gothenburg and VA Biotech, brought the vaccine back to IVI, developed it according to WHO standards, found funding from the Gates Foundation, Sweden and Korea to develop this vaccine, then transferred that technology back to Vietnam and also to India in order to manufacture vaccines that would allow WHO and Gavi to establish a stockpile for OCV. Shankal, the product of the effort with Shanta, now a part of Sanofi, was pre-qualified in 2011. A second technology transfer occurred with a goal to secure WHO pre-qualification for oral cholera vaccine in order to increase the global oral cholera vaccine supply through multiple tech transfers. And the two companies involved here were EuBiologics, a Korean company, and Incepta, a Bangladeshi company. The pivotal partners here were IVI and the ICDDRB, located in Dhaka. Facilitating partners included our funders, Korea, Sweden, and the Bill and Melinda Gates Foundation, Korea and Philippines, which hosted UVical clinical trials, Bangladesh, which hosted the Incepta clinical trials, and Gavi, which financed WHO's global vaccine stockpile. Beneficiaries here included EuBiologics, which received the vaccine, which they now manufacture, Incepta, which also manufactures a Bangladesh-approved oral cholera vaccine, Bangladesh, which now obtains a domestic OCV producer, and WHO and UNICEF, which are now able to better fulfill global cholera vaccine demand, which has exceeded 60 million doses. So the final outcome, the benefits for global health. We were able to establish and fill the global cholera vaccine stockpile. WHO, UNICEF, MSF, the IFRC can now obtain cholera for outbreaks, and very importantly now, to support a WHO effort known as Ending Cholera, the global roadmap to 2030, which aims to reduce cholera deaths by 90% by 2030. This is a prime example of sustainable development. The OCV price has now been reduced to $1.20 a dose, vastly expanding global access. Technology transfers have improved vaccine self-reliance in India, Vietnam, and Bangladesh. They've also improved or transferred vaccine manufacturing capacity to the manufacturers in those countries. OCV development has proven the efficacy and value of IVI's collaborative process and the SSTC development model. A second example, a second vaccine, is the typhoid conjugate vaccine. Typhoid conjugate vaccine development itself has as pivotal partners IVI, which is developing the vaccine, the U.S. National Institute of Health, which very importantly provided the conjugation vaccine platform technology that was used to develop this and actually now subsequently other vaccines, and then research institutes in Nepal and the Philippines for the execution of clinical trials. Our funders included Korea, the Bill and Melinda Gates Foundation in Sweden, and we are very grateful to Nepal and the Philippines for hosting the clinical trial efforts involved in typhoid conjugate vaccine development. The beneficiary partners here include Indonesia, which receives its own domestic supply of manufacturing of typhoid conjugate vaccine, and SK Bioscience and Incepta, which now have received the training and the new vaccine technology to manufacture TCV. A second example of SSTC is the support that IVI gives to typhoid conjugate vaccine introduction. This is a program known as THICA, which is trying to increase evidence to support the licensure and introduction of typhoid conjugate vaccine, TCV, in Africa. By conducting a phase 3 clinical trial in Ghana, effectiveness vaccination campaigns in the Democratic Republic of Congo, impact assessment and economic analyses in those two countries, and as well hopes to support 4 additional African countries to apply to Gavi for use of typhoid conjugate vaccine. Pivotal partners include IVI, the ICDDRB, and the University of Maryland, all of which help to coordinate this effort. The Fondation Merieux, which is helping with laboratory diagnostics, and then institutes in Ghana and the Democratic Republic of Congo that will be conducting the clinical trials necessary to achieve the aims of this grant from the European Union, the EDCTP program, and the Bill and Melinda Gates Foundation, which are together providing funding to support all the different stakeholders in this project. Ghana, which is hosting clinical trials, DRC, which is also hosting clinical trials, and the University of Cambridge, which is actually, in collaboration with IVI, applying to EDCTP for grants and manages oversight, project management, and support. The beneficiaries here are Ghana and the DRC, which are helping to stem or reduce the burden of typhoid in their populations, but also very importantly generate evidence that will support the policy introduction of TCV in those countries and in other countries in Africa, inform policy on TCV introduction, and finally, infrastructure, training, and technical support. In addition, we are supporting efforts in many countries for these countries for Gavi applications for TCV use. Finally, I'd like to talk about SSTC and the IVI Vaccine Diplomacy proposal. We would like the countries that support IVI to consider joining the Vaccine Diplomacy Advocacy Group, or VDAG. This is a multilateral collaborative framework using SSTC to advance the development and delivery of unincentivized vaccines, and IVI is offering to serve as a secretariat. The VDAG should be a problem-solving forum where problems are developed into project proposals, where we together identify and mobilize support and resources to move the project forward, and finally, establish consortiums and execute the project in order to accomplish development goals. And we'd like to encourage everyone, all the countries, the ambassadors, the embassies, and other organizations that are involved in this effort to advance vaccine diplomacy together. Thank you.
Thank you, Jerome. Now, Professor Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine, will share his pre-recorded remarks on the importance of vaccine diplomacy.
Congratulations to the IVI, the International Vaccine Institute in Korea, for hosting this very important summit on vaccine diplomacy. I'm sorry I can't be there with you. I remember with great fondness first visiting the IVI back in the 1990s during its founding, and it's been an extraordinarily important organization in this area of vaccine diplomacy. It's hard to believe that it's been more than 60 years, 64 years actually, since Albert Sabin made his first visit to the USSR, the Soviet Union, at a peak period in the Cold War, and then ultimately sent his polio vaccine strains. He visited again in 1959, and that's when the Sabin strains were first developed into a vaccine in the USSR. Shortly after Sputnik, at the height of the Cold War, the two countries put aside their ideologies to work together to create a life-saving vaccine, now leading to the elimination of polio globally. And the USSR and the US worked again to collaborate on smallpox to eradicate smallpox worldwide. And these are important examples of why vaccine diplomacy is such an important life force, not only to promote cooperation between nations and to improve foreign policy, but to actually save lives. Unfortunately, what we've seen during this time of COVID-19 is a reversal of that to some extent. It's vaccine diplomacy in many nations has been replaced by something which is being called vaccinationalism. We've had to create a new name because we've never had this before. For the first time, we talk about the American vaccine or the British vaccine or the Russian vaccine or the Chinese vaccine. And it's not supposed to work that way. That's not how we save lives. We need international cooperation, not only to jointly develop vaccines, but also to deliver vaccines. And this is why I think your conference is so absolutely urgent and vital at this very difficult period when we're seeing nations make one-off arrangements with the Chinese or the Russians or the pharma companies. We need to fix this, and I really think what you're doing could not be more important. So thank you for this, and you have my full support and cooperation. And again, I cannot say what how incredibly important IVI has been for this type of dialogue and for helping us build and promote the concept of vaccine diplomacy. Thank you.
Thank you, Professor Hotez. At this time, we invite the ambassadors of some of IVI's funding states and development partners to share their remarks. We begin with His Excellency Dr. Lee Jung-koo, Ambassador for Global Health Security of the Republic of Korea. Ambassador Lee.
Good morning, good afternoon, good evening. Mr. George Barkstaff, Chairperson of the International Vaccine Institute Board of Trustees, Dr. Jerome Kim, Director General of the IVI, distinguished participants from vaccine and health-related organizations, excellencies, ladies and gentlemen, It is my great pleasure to participate in the IVI State Forum 2020. Due to COVID-19, we can only get together virtually. This virtual forum allowed even more participants from across the world to join the meaningful events, including the excellencies and expertise from WHO, Gavi, CEPI, UNICEF, and the audience watching this event from live streaming. Since WHO declared the spread of the COVID-19 as a pandemic in March, the entire world has been fighting against COVID-19 for more than half years. Despite our fatigue from the non-pharmaceutical intervention and the behavior change such as wearing masks, washing hands, copying etiquette, we still do not know when we can fully overcome COVID-19. The only solution we all look forward to is the development of safe and effective COVID-19 vaccine. The whole world is putting enormous effort and resources into developing the vaccine. The international community is also discussing how to promote equitable and adequate access to COVID-19 vaccines for every country, every nation, every community. Vaccine cooperation become one of the most critical topics everywhere because of pandemic. The picture of the international vaccine cooperation we are growing together is the world free from the fear of infectious disease, in line with the vision that the IVI has purposed for decades. In that manner, IVI's proposal for the vaccine diplomacy advocacy group is very timely. IVI prioritized the development of delivery of incentivized vaccines and encourages every countries and partner organization to participate in the global cooperation for making vaccine more affordable and access for all. It is also meaningful that the IVI call for worldwide attention to COVID-19 vaccine as well as vaccine of diseases that are threatening many lives in vulnerable countries but are neglected due to lack of interest and monies. IVI seek to enhance our support for its activities and global solidarity toward vaccine cooperation through the VDAG. It also tries to facilitate this effort to ensure access to essential vaccines and building capacity in vaccine and vaccination for developing countries. Under the circumstance, the Republic of Korea is considering participation in VDAG initiatives in a positive manner. In fact, the government of Republic of Korea is already advocating and fully supporting the vision and activity of the IVI. The government endeavoring to raise awareness of the IVI in international communities, emphasizing its role and capacity both to develop and deliver vaccines. The Korean government is also actively encouraging countries and partners to join the IVI efforts and contribute to realizing its valuable objectives. As the IVI host countries, the Republic of Korea will contribute its unwavering support for the Institute. We anticipate that the IVI will further strengthen its role and contribution to global health agenda, particularly with the solid partnership with many other states and organizations. Thank you all.
Thank you, Ambassador Lee. Now, His Excellency Jakob Hallgren, Ambassador of Sweden to the Republic of Korea, will deliver his remarks. Ambassador Hallgren.
Thank you. Your Excellency, First Lady, Ms. Kim Jong-suk, Your Majesty, Queen Sylvia of Sweden, IVI Chair, George Bickerstaff, Director General, Jerome Kim, Excellencies, distinguished guests, and ladies and gentlemen, it is really my great pleasure to address this virtual IVI State Forum and the focus on global vaccine diplomacy and advocacy today. I wish to extend my heartfelt congratulations on behalf of the Swedish government to the IVI and the Republic of Korea on your strong partnership in advancing vaccines for global health. Sweden has enjoyed a long-standing relation with the IVI. Sweden was indeed one of the first countries to ratify the IVI Establishment Agreement and has supported the Institute from its inception. Over the years, IVI and the Swedish International Development Cooperation Agency, SIDA, have worked together, as Mr. Dr. Jerome Kim mentioned before, as partners to fulfill our shared vision of a world free of infectious diseases. And as a Swede, we consider the IVI a strategic partner due to this focus on diseases which mainly affect people in poverty, the people who benefit from unincentivized vaccines, those which are usually not a priority for the big pharma. So over more than 2 decades, IVIs have made important achievements in global health that include, as we heard, the development of the world's first low-cost oral cholera vaccine, establishment of the product development partnership model in Asia, strengthened capacity of developing countries in the vaccine spectrum, and now contributions to the COVID-19 vaccine development. And I must say that I'm really pleased to note that Sweden was actually a key player in the IVI's development of this world's first low-cost oral cholera vaccine. And as was mentioned before, the origins of the current vaccines can be traced to Sweden's University of Gothenburg, which is actually my alma mater, and the inventor, Professor Jan Holmgren. So with continued support from, I hope, a growing number of partners, we can ensure that IVI can replicate its successful development model with future vaccines such as typhoid, salmonella, and Shigella dysentery. And as regards COVID-19, Sweden supports IVI to leverage its network of infectious disease surveillance sites to conduct epidemiological studies of COVID-19 in Madagascar and in Burkina Faso. So, ladies and gentlemen, in these pandemic times, we must also focus on building back better and greener. And this applies equally to the vaccine sector. Gender equality and climate neutral solutions are key to the future also in this area. So once again, I really congratulate IVI today on your important efforts strengthening public health among those who need it the most. And we, as Sweden, look forward to our lasting partnership with you many years ahead. Thank you very much.
Thank you, Ambassador Hallgren. Now, Her Excellency Shri Priya Ranganathan, Ambassador of India to the Republic of Korea, will deliver her remarks. Ambassador Ranganathan.
Okay, great. Greetings to all of you, and it was truly a pleasure to listened to the very encouraging and insightful words of encouragement from Her Excellency Madame Kim Jong-suk of the Honorable First Lady, as well as Her Majesty the Queen Sylvia of Sweden. As of course the expertise of both DG Kim and the chairman of the Board of Trustees, Mr. Birkenstaff, shone through. So I would like to commend the IVI for organizing this very timely and relevant forum. I think the shared vision of all those of us who are part of the IVI family is to make available we really echo the mission of the IVI in taking the right steps at the right time to make available tested, reliable vaccines at affordable prices to the vulnerable populations across the world. And I think all those who are in this room today in our various locations completely endorse and stand by this philosophy and this mission and vision. Friends, I think I don't need to mention that the association of India with this fine institute has been a long and happy one. Like my colleague from Sweden, who mentioned that they have been state party to this to the institute for a long time, so has India been, and we stand ready to work together with the IVI in these very difficult and trying times. The point that was made by Dr. Hotez a short while ago, that is to say that at this time when the focus of the world, the focus of all well-meaning organizations and governments must be to build bridges through vaccine diplomacy, there is a kind of a wave of vaccine nationalism across the globe, and this is, I think, exactly what an organization like the IVI is seeking to bridge in order to create the kind of connections between those who are developing and researching these vaccines, trying these vaccines across the world, and eventually making it possible to manufacture these vaccines in the kind of numbers that the world is going to need. At this time when we are, when all of us are, I guess, locked into our respective locations because of the challenge of COVID-19, at least one silver lining that I can see is that the kind of doubt about the logic of vaccines, about the utility of vaccines, at least that is one problem that I think we are rapidly overcoming. The naysayers of vaccines as a means of tackling the world's health problems, I guess, are now increasingly in a minority, and the world is looking forward to readily available, affordable COVID-19 vaccines in the near future, so that the world is able to come together and overcome the kind of crisis that we are faced with. Having said that, and I think DG Kim put it very well, COVID-19 is just one of many diseases that the world will have to tackle in the times to come, as we have in the past. Whether it is chikungunya, whether it is the tuberculosis, whether it is typhoid, whether it is malaria, I think all of us as scientists, governments, and policymakers across the world, we have to join hands to make it possible for the vulnerable of the world to be able to have access to affordable vaccines so that they can remain safe from these diseases. I can only tell you from the point of view of the government of India, we stand ready to work with the IVI and with our friends and partners across the world to contribute to this exercise. We would be very willing partners to any solution that is found in the coming months and years to overcome, to use vaccines as a means of overcoming not only the COVID-19 pandemic, but other health crises that will surely affect us in the time to come. Once again, I would like to thank the IVI for organizing this very timely online event on building vaccine diplomacy and advocacy across the world, and we will remain very active and enthusiastic partners to the IVI in its activities going forward. Thank you all, and I wish you an excellent day. Thank you.
Thank you, Ambassador Ranganathan. Now, Mr. Pekka Metso, Ambassador Designate of Finland to the Republic of Korea, will deliver his remarks. Ambassador Metso?
Yes, hello. Your Excellencies, ladies and gentlemen, I'm really glad to have this opportunity to attend the International Vaccine Institute's 2020 Virtual State Forum. Firstly, I would like to thank the International Vaccine Institute for its valuable work in vaccine research and development. My government supports research initiatives and institutes that have the opportunity to respond to the public health needs, especially in the less developed countries. I'm particularly happy that Finland joined the IVI's activities this autumn as a full member and as an active financier. In this connection, it's essential to highlight that Finland and IVI have actually much longer history of cooperation, for example, in international health security programs and in exchanging information. Several Finnish experts have also been involved in IVI's activities already over 2 decades. In addition to the IVI's valuable work, Finland supports other global vaccine research and development, as we will hear later on, through international collaboration with key partners such as WHO, CEPI, and Gavi. I'm particularly pleased that the IVI is working for the values that are also important to us. The development of effective and efficient vaccines against communicable diseases is a key to reduce inequalities, to reduce poverty, and to promote especially the health of women and girls. Ladies and gentlemen, I have been asked to say a few words on Finnish views regarding the model of South-South and triangular cooperation in sustainable development. Health security is a global public good. Outbreaks of infectious diseases and health emergencies, coupled with gaps in health systems and cross-sectoral preparedness, pose some of the greatest risks to the global economy and security. Finland has been active in contributing to strengthening multi-sectoral cooperation through international organizations and different multi-stakeholder platforms, such as the Global Health Security Agenda and the Alliance for Health Security Cooperation that bring together countries, international organizations, non-governmental actors, and the private sector across different countries and regions to strengthen preparedness and response to health threats. The COVID-19 has demonstrated important lessons to us. Exchange of experiences has been critical in this unprecedented crisis. The pandemic has also created new and transformative global models of cooperation for preparedness and response. For example, with the view to ensure equitable access to vaccines and other technologies, which we hope to have a lasting impact in the global health landscape. Ladies and gentlemen, we are still living in the midst of the global COVID-19 pandemic, even though we can feel relatively safe here in Seoul. It's of key importance that the vaccine against the COVID-19 virus is effective, safe, and available to everyone who needs it. COVID-19 vaccines are a global public good for health. I have a strong conviction that IVI operates in accordance with these principles in all its activities. All the best to DG Kim and his team. Thank you very much for your attention.
Thank you, Ambassador Metso. Now, His Excellency Bruno Figueroa, Ambassador of Mexico to the Republic of Korea, will deliver his remarks. Ambassador Figueroa.
Thank you very much. On behalf of the Mexican government, I thank IVI for its initiative to host such a timely forum. It is an honor for me to take the floor after such important personalities that, for the benefit of brevity, I will not mention. As had been said so well, in the current circumstances that the world is facing, only a strong and effective solidarity can help us overcome this unique health emergency and the dire economic situation most of our countries are facing. Solidarity is structured in different manners according to the different actors. I will focus on the so-called South-South cooperation, that is, solidarity coming from developing countries such as Mexico, my country. Triangular cooperation involves also developed countries and third parties such as international organizations. In its approach to health and vaccines, Mexico has a very long tradition of cooperation with low and middle income countries. And in the face of the COVID-19 pandemic, it made a prompt call to the international community to act in a cooperative manner, firstly in the special G20 virtual summit of March 26, attended by my president, Andrés Manuel López Obrador. Mexico then launched the negotiation of a UN resolution about international cooperation to ensure global access to medicines, vaccines, and medical equipment to face COVID-19. With more than 160 co-sponsorships, it was adopted on April 20. The main commitment by the international community is to grant universal and equitable access to treatments and vaccines, as well as their fair distribution. It recognizes the role of extensive immunization against COVID-19 as a global public good for health in order to bring the pandemic to an end. Mexico has been working in multiple arenas since the beginning of the pandemic, supporting in particular the WHO as the prime international body responsible for the coordination of the international response. My country contributed to set up the ACT Accelerator, as well as to the design of a fair allocation framework. Equitable distribution is crucial in the area of vaccines. Inclusiveness is also key, as mentioned by First Lady Kim Jong-suk. We also joined Gavi only last month in September, and 5 days ago, we contributed $160 million to the COVAX facility mechanism. We want to ensure fair and equitable vaccine access to countries such as Mexico and also to less developed ones. On May 4th, Mexico joined the Coalition for Innovation in Preparedness for Epidemics, CEPI. And within this framework, we are looking for funds to develop 6 Mexican vaccines from different universities, research centers, and local companies. At the regional level, Mexico has led some initiatives to support those mentioned above. The Community of Latin American and Caribbean States, CELAC in Spanish, co-chaired this year and next one by my country, has established some meaningful experts networks, such as a virologists network. Finally, Mexico and Argentina joined forces to market and distribute the vaccine developed by AstraZeneca and Oxford University. This not-for-profit collaboration aims at facilitating an earlier distribution of the vaccine to other Latin American countries. This is full South-South cooperation in action. IVI, the International Vaccine Institute, is very well positioned to support these international initiatives and many others, taking into consideration its wide expertise in the field and experience with low and middle income countries, as Dr. Jerome Kim presented in detail. Mexico has approached IVI for potential cooperation, and we welcome IVI's new platform focused on strengthening South-South and triangular cooperation. Thank you very much for your attention.
Thank you, Ambassador Figueroa. Now, Her Excellency Mumtaz Zahra Baloch, Ambassador of Pakistan to the Republic of Korea, will deliver her remarks. Ambassador Balochi.
Thank you very much. Honorable First Lady of the Republic of Korea, Her Majesty Queen Sylvia of Sweden, Chairman Board of Trustees and Director General IVI, dear participants and my fellow colleagues in the diplomatic community. It is my great honor to attend this forum and to speak on the Vaccine Diplomacy and Advocacy Group. Excellencies, ladies and gentlemen, in May 2012, the World Health Assembly launched the Decade of Vaccines with the vision of delivering universal access to immunization by 2020. 10 years later, we as international community have failed this target, and basic immunization and overall global immunization coverage has stagnated. Almost 20 million people die every year of preventable diseases for not being able to receive routine life-saving vaccination. Only 10% of health research is devoted to conditions that affect 90% of global disease burden. These are sobering statistics. This year's epidemic has shown how our interconnected world remains vulnerable to infectious diseases. It has reminded us how infections impact the poor and weaker segments of society. COVID-19 has also burdened health budgets and choked the health systems, especially in developing countries. It has set back immunization campaigns as health workers and governments alike respond to this urgent and latest epidemic. The COVID epidemic has also brought to the fore the importance of working together to find common solutions. As a global community, we should ensure that the current epidemic does not take away our attention or global resources from vaccines that are critical for health and lives of millions around the world. Creation of IVI Vaccine Diplomacy Advocacy Group initiative in these circumstances, in our view, is thus important and very timely. VDAC can play an important role in calling global attention to and becoming a leading voice for vaccine solidarity without borders and a world free of suffering from infectious diseases. IVI has done a remarkable job in staying true to its objective of enhancing capacity in development of vaccines against preventable and neglected diseases. By developing partnerships with international organizations and stakeholders, it can accelerate this process and call attention to world leaders to this common cause. We hope it contributes to a multilateral approach to vaccine development and prevent the so-called vaccine nationalism. We hope VDAC will enhance the profile of IVI and the commendable work it is doing in bridging the gaps in vaccine R&D and capacity building against preventable diseases. This is important as thus far IVI's initiatives have not received prominence in the health-related ecosystem of Geneva. Pakistan is ready to partner with IVI in R&D, clinical trials, and disease surveillance activities, and will join the VDAG as an active partner. I thank you all for your attention.
Thank you very much, Ambassador Baloch. At this time, we invite the representatives of IVI's global health partners to share their supporting messages. We begin with Dr. Richard Hatchett, CEO of CEPI, the Coalition for Epidemic Preparedness Innovations. Dr. Hatchett?
Thank you for that kind introduction. Your Excellencies, ladies and gentlemen, I'd like to, it's an honor to join the IVI Virtual State Forum today. I certainly want to thank George Bickerstaff and Jerome Kim for inviting me to speak today. And on behalf of CEPI, extend our kindest greetings to the First Lady, Madam Kim Jong-suk, and Her Majesty Queen Sylvia. I want to start by applauding IVI for their tireless work over the past 23 years to develop and deliver safe and effective and affordable vaccines for developing countries. Vaccines, we all know, are critical for global health, and enabling access to these vaccines is vital to ensuring that the world's most vulnerable people are not left behind. Nothing has focused the world's attention on this truth more than COVID-19. Over the past 10 months, this disease has dominated our lives, devastated our economies, and destroyed countless lives. CEPI believes strongly that it is only through collective action that such transnational threats can be contained. Multilateral cooperation will be essential if we are to develop vaccines, ensure they are distributed equitably, and defeat this pandemic. The desire to promote such cooperation has motivated CEPI, Gavi, and the World Health Organization to establish COVAX, which aims to enable globally fair allocation of COVID-19 vaccines to end the acute phase of the pandemic as quickly as possible. Over 170 countries around the world, now representing more than 90% of the world's population, are backing this global initiative. Nothing like this on such a scale or at such speed has been attempted before. This is the first time that the world has come together to make sure that new life-saving medical technologies are made available to all countries at the same time as soon as they are licensed. I'm pleased to say that the Republic of Korea is among the countries that has supported the establishment of COVAX from the very beginning, and that there is no doubt that Korea will contribute substantially to the response against COVID-19. Korea's biomanufacturing industry has world-leading capabilities, and CEPI has recently partnered with SK Bio to support manufacturing of a number of COVID-19 vaccines. IVI, as Jerome has described, shares CEPI's commitment to international cooperation, to ensuring equitable and uninterrupted access to vaccines, and to promoting vaccine sustainability and self-sufficiency at the country level. And CEPI and IVI, as he mentioned, already have partnerships in place to develop vaccines against COVID-19 and against chikungunya. As COVID-19 continues to upend our lives and livelihoods, research and development dollars are understandably being channeled into vaccines, treatments, and diagnostics against this disease. It is, however, critically important that the funding community not lose sight of the threats posed by other endemic and emerging infectious diseases, especially when potential commercial markets for vaccines against such threats are weak. Vaccines will remain our most powerful tool against these pathogens, and CEPI therefore welcomes IVI's establishment of the Vaccine Diplomacy Advocacy Group to promote vaccine development, access, and capacity building. As we look into the future, we share IVI's vision of the potential of multilateral cooperation to power the development of vaccines against diseases for which market incentives are lacking. We must build on the collaborations forged in the crucible of COVID-19 so that we can advance and improve global health and development. And I look forward to working with IVI and the other global health partners represented here today on that journey. Thank you.
Thank you, Dr. Hatchett. Now, Ms. Etleva Kadilli, the Director of UNICEF Supply Division, will share her remarks. Ms. Kadilli?
Thank you so much, Your Excellencies, ladies and gentlemen. Greetings from UNICEF. Let me first express my gratitude to the International Vaccine Institute for the State Forum event and to my fellow panelists for their insightful and powerful remarks. UNICEF is honored to be here among you today in this important forum. Each year, UNICEF procures and delivers nearly 2.5 billion doses of vaccines for routine immunization and outbreak response, reaching nearly 45% of the world's children under 5 years of age. The lives of more than 13 million children have been saved over the past 20 years, an achievement which wouldn't have been possible without the efforts of many partners and stakeholders. The Republic of Korea is one of our long-standing partners, and as stated today by the Director of IVI, UNICEF has procured and delivered, among others, oral cholera vaccines in underserved settings. Our collective efforts have achieved an incredible track record of scaling vaccines to address inequities and save lives. IVI's commitment to vaccine development has played a critical role in the equity agenda. The oral cholera vaccine is just one example of how IVI's investments have made life-saving differences to millions of children and families. UNICEF is grateful to IVI for seeking to replicate this success by accelerating the development of other unincentivized vaccines and for championing the Vaccine Diplomacy Advocacy Group to make vaccines affordable and accessible for all. The COVID-19 pandemic has brought a new urgency to ensure the continuation of routine immunization services. We must support countries to continue these services. We cannot let COVID continue to roll back progress. With every challenge comes opportunity, and we must use this as an opportunity to build back better, to strengthen essential health and routine immunization services. In this context, partnerships around shared values and goals, such as the Vaccine Diplomacy Advocacy Group, has become more important than ever. It is only with a strong collective approach and triangular cooperation that we can achieve success. We have seen this with the polio eradication efforts, and the same will be needed for COVAX. COVID-19 vaccines will be the largest and the fastest procurement and supply operation ever. UNICEF is committed to leveraging its strengths in market shaping and procurement, again, at all what we have gained over the 30 years, working with partners such as IVI towards our joint goals of saving the lives of children and building back better. Thank you for your kind attention.
Thank you, Ms. Kadilli. Next, Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization, will share her pre-recorded message.
The Honorable First Lady of the Republic of Korea, Madame Kim Jong-suk, Dr. Jerome Kim, colleagues, ladies and gentlemen, it gives me great pleasure to speak to you on this occasion of the IVI's State Forum. I'm Dr. Soumya Swaminathan from the World Health Organization. I'm the Chief Scientist, and I want to congratulate you for having done tremendous work over the last many years. I have been associated with IVI since I was in India as the Director General of the Indian Council of Medical Research, and also now as I'm leading the vaccine efforts for COVID-19 at the World Health Organization, working closely with our partner agencies CEPI and Gavi. Our goal is to try to accelerate the development of as many vaccine candidates as possible in the shortest possible time, while making sure that we are paying attention to the clinical trials that are being done well, robustly, to evaluate safety and efficacy, and then to be able to ensure fair and equitable access to this vaccine for people all over the world. We know that vaccines offer us the best chance of coming out of this pandemic, and that the whole world is actually looking forward to having vaccines. And therefore, we feel very responsible in the WHO to ensure that we work with all our partners across the world to ensure that these vaccines, when they are developed, are able to protect people in every country. We know that this pandemic doesn't respect borders, it doesn't respect sex or age or nationality. It will go and infect people wherever it can find susceptible people. And therefore, it's only when everyone is safe that all countries can actually resume normal global economic activity. And so there is no point in having a few islands where people are protected while the rest of the world is waiting. So this is why we call for global solidarity and collaboration. And I've been very encouraged to see the response, both from the scientific and academic communities, but also from the private sector, as well as from many countries around the world who've committed themselves to the spirit of solidarity, to the spirit of equity and justice for all. So I wish IVI, who's one of the partners in this initiative, all the very best, and I'm looking forward to working with you in making this dream a reality. Thank you so much.
Thank you, Dr. Swaminathan. Now, Dr. Seth Berkley, CEO of Gavi, the Vaccine Alliance, will share his pre-recorded message.
Dr. Jerome Kim, ladies, gentlemen, and distinguished delegates, I'm delighted and honored to be here virtually with you today to discuss such an important topic. In fact, the launch of building vaccine diplomacy and advocacy, particularly when we're doing so to advance the development and delivery of unincentivized vaccines, could not be more critical or appropriate. At a time when almost every country is experiencing an unprecedented existential crisis, governments are looking beyond the immediate needs of their citizens in favor of working together towards a solution that benefits everyone. That solution is the COVAX facility. With more than 180 countries now involved, including our host, the Republic of Korea, and collectively representing more than 90% of the global population, the COVAX facility is the biggest multilateral effort since the Paris Climate Agreement and the world's best hope of ending the acute phase of the pandemic. It is the only truly global solution because it's the only way to ensure rapid, fair, and equitable access to SARS-CoV-2 vaccines, and the only way to protect people in all countries, regardless of their ability to pay. The launch of the Vaccine Diplomacy and Advocacy Group encompasses the same spirit of multilateralism and collaboration, and that of the SDGs to leave no one behind. This International Vaccine Initiative-led initiative to make vaccines more affordable and accessible for all is very much aligned with Gavi's core mission because of its mandate to create equal access to new and underused vaccines for children living in the world's poorest countries. Vaccine diplomacy and advocacy is critical under the current circumstances where coronavirus-related disruptions to immunizations put millions of children at immediate risk and threatens to unravel decades of progress. Indeed, if one suspended routine immunization in Africa to prevent COVID-19 deaths, for every COVID death prevented risks an additional 84 vaccine-preventable deaths. So we don't just need COVID-19 vaccines, we also need to ensure that routine immunization continues throughout the crisis to prevent simultaneous outbreaks of other diseases. I see a great synergy with what the VDAG envisions to prevent such tragedy. I wish all of you a successful meeting and look forward to working closely with you going forward. Thank you.
Thank you, Dr. Berkley, and thank you again to all of our speakers tonight. I know we're running a little bit behind schedule, but as we close the State Forum, I would like to open up the the floor if there are any additional questions or statements. Anyone there have anything additional to add? Well, seeing none, in that case, we will invite Dr. Jerome Kim up to the podium to deliver his closing remarks.
I would like to thank our honored guests, speakers, and attendees for your time and support. I'd also like to recognize the hard work of the Global Affairs team led by Young-Mi Cho and Colin McCann for organizing this virtual State Forum. Global health starts with critical needs, examined with concern and empathy, informed by research, made real by our experience and our shared experience, given hope by the discovery, development, and delivery of vaccine solutions, and transformed by funding, policy, advocacy, and our global health partners into passion and action. Please help us to move vaccine diplomacy forward. Help us to bring innovative vaccines to the challenges of global health. Thank you, good day, and good night.
This concludes the IVI State Forum. Thank you very much to everyone for joining us this evening and this morning and participating. We look forward to communicating with you in the future and hopefully working together on vaccine diplomacy. Young-Mi?
Yeah, I look forward to a physical, not virtual, physical State Forum next year with all of you. Thank you very much. See you next year.